My name is Gino, I'm 39, and I'm an engineer. I'm considering having rhinoplasty today with Dr. Cruz. I think having this procedure will give me a lot more confidence in everyday life. In addition to the physical changes, I think that's really what I'm going for here, is something to boost my self-image and to feel more confident about myself.
Hi, I'm Dr. Joseph Cruz. I'm a board-certified plastic surgeon who practices in Newport Beach. At Cruz Plastic Surgery, we have a staff of highly trained medical professionals who are dedicated to making sure that your plastic surgery experience is as comfortable and as positive as possible.
Hey Gino, how are you?
Hi, nice to meet you.
Good, thanks for coming in today.
No problem.
What brings you here?
Well, I've always wanted to get my nose done. I've always been very dissatisfied with the look of my nose.
What in particular do you know about it?
The hump in my nose.
Okay.
I've never liked, and I've always thought about getting it changed.
So now you just decided it's time to do it, huh?
Why not?
Okay.
Well, Gino is an interesting case because actually when Gino first came to see me, his main concern was his nose. But when I took a picture and went over his facial structure, it became readily apparent that really it's his recessive chin that was contributing to his problem.
All right, Gino, this is where I think we can get you. Looking at the nose to get you a straight dorsum, to define the tip just a little bit, to give projection to the chin, and then create a neck angle for you. Also, what I'm not showing is we're going to get more jaw definition too, definition of the jawline. But here's you, and here's where we can go.
Wow.
Many of my patients don't really realize the power of the chin, and it's not till I actually take a picture of them and show them on digital imaging how much of an effect the chin has on the overall face. And Gino is an excellent example of that. He came in primarily for his nose and secondarily for his neck, but when you look at him, it's his recessive chin that is a significant component to his problems. Typically what I see are patients that come in and they want to regain that youthful neck that they used to have. Gino's situation is totally different. Gino never had a neck, and that makes it particularly difficult on me to try and create a neck. So, and that lends itself to the technique that I use for neck lifting, which is a suspension method, literally lifting up the muscles of the neck. So it's going to be a big challenge in order to get all that mass back up to where we want it to be in order to define his chin and give him a jawline. I'm very confident that I can give him the look, even surpass what he was hoping for.
Woke up nervous, now I'm kind of anxious, so I just want to go in and get this done. I'm very confident with Dr. Cruz, and I trust him, and I know he's going to do a good job.
Hello.
Hi, Dr.
Gino.
Cruz.
How are you?
I'm doing okay, how are you?
Good. Excited?
Yeah, I am. A little nervous.
I can imagine that. Well, don't be nervous. This is what we do all the time.
Okay.
And especially, I mean, this is probably the most common procedure we do on men.
Okay.
So what we're going to do is to go. We're going to start with your neck, because what we really need to do is to define your neck and to give you a neck angle back. So we're going to give you a little bit of the jawline definition and then bring your neck angle up.
Okay.
And, you know, like we talked about before, this is very common. A lot of men over the age of 40 have, you know, the saggy neck, the poorly defined jawline, and this is a great way to go without getting a facelift. So you don't have the downtime of a facelift, and you don't have the scars of a facelift. So remember, all the incisions are going to go behind the ears. There's not going to be anything in front of the ears. Okay. And your face won't be swollen from this.
Okay.
But in addition to the neck, we're going to be doing your chin, because in order to get your profile where we want it, we really want to get more projection from your chin.
Right.
And we're going to actually be putting in a pretty good size implant to do that. And then to finish off your profile, we're going to take down the hump on your nose. Then we're going to narrow your nose.
Okay.
And we're going to define your tip.
Okay.
Sound like a plan?
Sounds like a plan.
All right, well, let's do it.
All right, thanks.
Well, we're about ready to get started with Gino. We're going to start with his neck lift. And our goal is to be able to define his jawline and to be able to give him a neck angle, which he hasn't really had for his whole life. We're going to get started. What I've done is, as far as outlining the amount of skin excess, I can calculate it by pulling on it, because the skin is going to be re-draped behind the ears. So I figure that out, mark it, and then I'm going to start off by excising that, and then I'll do the rest of my dissection later. The bulk of the operation is actually suspending the muscle, the platysma muscle, and in Gino's case, it's going to be removing all this excess fat that he has. Well, we've just finished the neck and did the chin implant, so we established his jawline, and I'm really happy with the way it went. I think it's going to be a real positive for Gino here. We're going to move on to the nose now. Everything went just according to plan, so I'm excited for Gino because we've already got the result that we wanted to on the table, and I know he's going to like it. So we're going to take him to recovery, and that's it.
Hi, Nicole. I'm here to see Dr. Cruz.
Wow, Gino, you look great.
Thanks.
Hello, Gino. How are you doing?
I'm doing really well, thanks.
Good. How are you feeling?
I feel good. Good. No problems at all.
Excellent. How long has it been since the surgery?
It's been about 7 weeks now.
Well, just looking at you, it looks like we achieved the goals that we wanted to achieve, which I was pretty comfortable that we would. I mean, we've certainly created and defined your neckline and your chin.
Yeah, I'm really happy with that. I think it turned out great. It's actually a little bit better than I thought it was going to be, so I'm pleasantly surprised. I'm very happy about it. So I always had that kind of like the double chin, very little definition there. So yeah, this is totally new for me.
How do you feel that the nose fits into your overall appearance?
I think the nose initially was a huge concern for me, and it ended up, after all the surgery was done, to be kind of secondary after the neck and the chin. I mean, I think the neck and the chin were really what made this look so good. The nose I basically just wanted flattened, just a little bit of a tweaking to it, and I got that. I'm glad I did it.
Gino looks great. We were able to give him the look that he was coming in for. When I first saw him, he didn't have a neck, had a very recessive chin, and the nose was way too projecting. But now he just looks great. He's got the profile that he was looking for.
I definitely got what I was looking for, and in addition to the appearance, it's the addition of self-confidence, where you get up and you feel great about going outside and interacting with everybody, and it's just made a big difference. I think my personality has always been there. I think now it's just come out more. Now that I have the more self-confidence, it's my natural personality is just coming out, and I think that's great. My friends were very pleasantly surprised. Again, once the initial shock wore off, because they're used to seeing me a certain way, then they start commenting on how good the results turned out. I think it's important to feel good about yourself. So, and if you decide that you want something done, if you're considering plastic surgery, and you think it's a good idea, I would highly recommend it. And if you're going to do it for yourself. Don't do it because somebody else says you should do this or you need to do this. It's got to come from within yourself. And if you feel that this is going to make you look better, this is going to make you feel better, then by all means, I highly recommend doing that.
Well, I'm just really excited about Gino. I mean, he is really happy right now, and I'm happy for him. We were able to give him the neck that he wanted. He never had a neck. He's unusual that he never even had a neck, and we were able to give him the neck that he really wanted. And you can see it. You can see it in his eyes. He's much more confident now. So that makes me very happy.